Now we are tackling alcohol and the liver, the pathogenesis of fatty liver disease. Let's find out why a clear liquid turns your liver yellow. Now let's talk about the alcohol. Here's the core question. Why does drinking alcohol make your liver fat? Is it because alcohol has fat in it? No, it comes down to basic biochemistry. I call this concept the fatty switch. Alcohol flips a switch in your liver cells that changes them from fat burners to fat storers. Let's see how. To understand the switch, you need to know the players. Mechanism. When your liver breaks down alcohol or ethanol, it utilizes a specific enzyme, alcohol dehydrogenase. Look at the equation. Ethanol meets alcohol dehydrogenase and becomes acetaldehyde. Simple, right? But there is a hidden cost. Here's the twist. This reaction isn't free. It converts NAD+ into NADH. Think of NADH as cellular energy currency. When you drink a lot, your liver gets flooded with NADH. It's like printing fake money. Suddenly the liver thinks it is rich in energy. This leads to the liver's misunderstanding. Look at the liver in the slide. It's saying, wow, I have so much energy, I don't need to burn fat for fuel anymore. In fact, let's store this energy. Because the NADH levels are so high, the liver thinks it has just eaten a massive meal. So it shuts down its fat-burning furnaces. This is fat logic. Two things happen simultaneously. Fat burning stops, there is decreased fatty acid oxidation, and fat building starts. Increased lipid synthesis. The liver takes all that energy and turns it into triglycerides. The result? Hepatic steatosis, also known as the fatty liver. Look at the liver on the screen. It is yellow, greasy, and enlarged. Why? Because it is literally stuffed with fat that it refused to burn. But remember, this is just the beginning. Let's walk through the stages of destruction. Stage 1 is steatosis. Key feature, look at the cell, it has fat vacuoles. See how the nucleus is pushed to the side? This is reversible. If the patient stops drinking now, the liver goes back to normal. But if they keep drinking, we hit stage 2, alcoholic hepatitis. Now we have ballooning degeneration. The cells are dying, they swell up and rupture. This triggers inflammation. The immune system wakes up and attacks. In alcoholic hepatitis, you see something specific under the microscope. Mallory tank bodies. Look at the image. These are damaged intermediate filaments, cytokeratin 8 and 18. They look like pink twisted ropes inside the cell. This is the hallmark of alcoholic hepatitis. Who comes to fix the damage? The cleanup crew, neutrophils. Unlike viral hepatitis, which has lymphocytes, alcohol injury calls in the neutrophils. They rush in to clean up the mess caused by cell death, but their presence causes even more inflammation. Finally, we reach the end of the line, stage 3, cirrhosis. This is the scar. Look at the liver now. It's not yellow and soft anymore. It is full of hard nodules separated by fibrous bands. The liver structure is destroyed. And the most important word in this slide, irreversible. Here's the timeline of destruction. Healthy liver, steatosis, which is reversible, then hepatitis, inflammation occurs, and then after the point of no return, there is cirrhosis. Your job as a doctor is to catch the patient before they cross that line. Let's do a quick review. Stage 1 is steatosis. Key feature is fat vacuoles. Stage 2 is hepatitis. Key features are ballooning, Mallory tank bodies, and neutrophils. And stage 3 is cirrhosis. Key features are fibrosis and nodules. Memorize these keywords for your exams. That's the story of alcohol and the liver.